Today we talked to the state health officer about what happens next now that both Pfizer and Moderna say their trials show their vaccines are more than 94% effective. Waay 31's Sydney Martin is live in Huntsville tonight.
She learned representatives from the Centers for Disease Control and Prevention are at the Department of Public Health this week. They're helping the state make plans and preparations for a vaccine. Sydney.
Naja, today's State Health Officer Scott Harris told me they've learned from the CDC once a vaccine's approved, allocation will be based on population per capita. He believes that means Alabama will receive a few 100,000 vaccines, but that doesn't mean all healthcare workers that can get it in the first round will be able to.
We have within that group of healthcare workers prioritization there as well for those people who are most at risk. You know, those people working on actual COVID units, taking care of patients, those people who are doing aerosol generating procedures that put them at higher risk.
Dr. Scott Harris told me he's working with the federal government and the Centers for Disease Control and Prevention to prepare the state to receive doses of the coronavirus vaccine as early as the middle of December. This week, Moderna and Pfizer have both released that their COVID-19 vaccine trials are showing about a 95% effectiveness rate in people who participate.
I don't think we really know exactly what they mean when they say 95% effectiveness. You know, most vaccines aren't nearly that effective. You know, we have some like the measles vaccine that are highly effective in the high 90% for people who complete the series. But, you know, compare that to the flu vaccine, which is, you know, in a good year, maybe 50% effective.
Harris explained once the CDC and an advisory board review that data during the emergency authorization process, it will help bring greater understanding. But he said, like any other vaccine, these will not be cures for the virus.
As the vaccine comes out, we don't want the public to suddenly think, okay, we're over the hump and everything's fine. We're not going to have enough for several months, and we still need to continue to ask people to be safe.
He also told me today children and pregnant women most likely won't be eligible for either of the vaccinations currently being widely discussed.
We know for a fact that none of the trials so far have recruited enough children or pregnant women that there's going to be any approval for children and pregnant women to receive the vaccine. But, you know, ultimately the FDA and the advisory committee are going to make that determination.
Now today, Madison County Health Officer Dr. Karen Landers, who's also a pediatrician, said that she's asking for trials for a children's vaccine to be sped up along with the American Academy of Pediatrics. They're also asking for that. She said that getting a vaccine available for children is very important. Live in Huntsville, Sydney Martin, Waay.